I give the floor to UNFPA, the UN World Population Fund.
With only 7 years left to achieve the SDG target of universal health coverage, UNFPA is committed to ensuring that indigenous peoples and Afro-descendants' sexual and reproductive health and rights are upheld. While data is scarce, available evidence shows that across the globe, indigenous and Afro-descendant women and girls have poorer access to health services, experience worse sexual and reproductive health outcomes, and higher rates of violence than non-indigenous women. In 2017, where data is available, the maternal mortality ratio for indigenous women was 239 deaths and 162 for Afro-descendant women, compared to 86 deaths per 100,000 live births for non-indigenous and non-Afro-descendant women. A 2018 UNFPA, UNICEF and UN Women fact sheet on the maternal health of indigenous women and girls found that they are overwhelmingly less likely to receive health services and have higher adolescent birth rates. Moreover, UNFPA has published this year a fact sheet on the maternal health of Afro-descendant women and girls in the Americas. The fact sheet has found that Afro-descendant women and girls face significant challenges before, during and after pregnancy, contributing to higher rates of maternal mortality both in developed and developing nations. Both these fact sheets suggest that systematic racism and gender discrimination are fundamental barriers to achieving the highest attainable standard of sexual and reproductive health, including maternal health. Moreover, they highlight the dearth in data on the health status of indigenous and Afro-descendant women, thereby rendering their situation invisible in policy responses. As far as indigenous peoples, of the 90 national subnational surveys conducted under the last 2 rounds of multiple indicator cluster surveys and demographic health surveys, only 8 countries had published data on indigenous peoples. UNFPA advocates for and supports disaggregated statistics in administrative records, census surveys, and adequately quantify the challenges faced by people of African descent and indigenous peoples. National governments and healthcare providers can meet the sexual and reproductive health needs of Afro-descendants and indigenous women and girls by addressing the structural racism, sexism, and discrimination, ensuring access to disaggregated data, and working in partnership with civil society, including Black and indigenous community leaders. I thank you.